No matter where you were born, FAHE believes you deserve the right to live a healthy life with clean water, affordable medical care, a safe home, and belong to a community that nurtures the most vulnerable among us. Nelson County, Virginia is just one of hundreds of communities in the U.S. without access to quality health care. A small community health care clinic tried to fill the gaps. Still, there was no local dentist or pediatrician accepting new patients, Medicare, or Medicaid. Access to a traditional pharmacy was non-existent. Only volunteer emergency services working from a trailer served Nelson County residents in need of immediate care, but most had to travel far outside the county for basic health care needs.
More often than not, access to decent health care is a struggle, I think, for a lot of Appalachian communities.
Blue Ridge Medical Center is a community health center located in Nelson County. It was first opened in July of 1985. It was a very tiny place, a modular building about the size of a double wide. There is a lot of poverty here. It's a medically underserved area. It's also a health professional shortage area. And so Blue Ridge's mission is to really make sure that access to care for people in Nelson County and surrounding communities is equal to whatever it would be for everybody, and to make sure that our health outcomes are the same.
It gives patients a place to go locally, especially the elderly who may be intimidated by the bigger hospitals and medical facilities, and it gives our local people a place to come where they're not an all-day visit, an all-day stay.
Came to Blue Ridge Medical Center in 1985 when they first opened up, and I've been coming ever since.
The center needed to expand because we were packed into a small space. Our pharmacy was providing over 200 prescriptions a day, and there was just not enough room to put our inventory on the shelves, and so we knew we needed more space.
As a general rule, everything we want to finance really does have to have two real critical functions to it. One is it has to be meaningful and useful to the community at large. The second, though, is how does that create jobs, and jobs that will stay, jobs that have high skill and good pay and are a permanent part of driving a local economy forward. I think that's a focus that Appalachia has often missed. FAHE was really interested in financing this expansion in particular just because of the tremendous need that we saw in the county and the lack of access that people have not only for medical services we often think of them, but also dental, pharmaceuticals, just not available on any meaningful level. Our sister organization is Virginia Community Capital, an organization that we actually helped to start about 5 years ago.
Virginia Community Capital does lending in 4 community focus areas: affordable housing, economic development, Main Street revitalization, and community facilities. Very similar to Blue Ridge, with a specialty on medical facilities in medical underserved areas. And this transaction was a total of about $8 million. And so we were able to help Peggy with the financing that she needed to get this new expanded building up and running.
Our pharmacy has been able to spread out, and they've been able to order the inventory that they need, and now we can add pediatric services, and that's another thing that we found was much needed in our county. 70% of the students in Nelson County schools are going outside of the county for pediatric care.
As word gets out that we're providing pediatric services, we're starting to get new patients coming here who've been driving to Charlottesville or Lynchburg to get their pediatric care and want something closer to home.
And then when we finish the second phase of the expansion, we'll be able to add dental services. And that's been a dream for a long time.
I grew up in Nelson County. I initially heard about this project in 2009. At the time, I had just graduated dental school, and as soon as I heard about it, I knew I had to be a part of it. Currently here in the Nelson Dental Clinic, we only have 2 dental chairs. But when Blue Ridge opens their new dental clinic, there will be 6 chairs. So we will increase the amount of patients we can see. Hopefully we'll be able to expand our services as well, and hopefully be able to, in the future, hire some more dentists, just to provide more access.
So with the whole expansion, we've got about 10.75 FTEs or full-time equivalents that we've been able to add.
There are construction jobs that come along with these projects. The jobs that are created in these centers are good living wage jobs with benefits that you can raise a family on.
I really like working here at Blue Ridge. I have a son with special needs, and being that he's close by and has a seizure disorder, it worked perfectly for me to be close by here.
As a community development financial institution, helping put people back to work, which is what this country really needs, is something that is an important driver to our everyday work.
Our mission will not change. It will always be to increase access to care for people who don't have it and to equalize those health outcomes, to make sure everybody has access to good health care and the good outcomes that they can get from quality care that we can provide.
This kind of expansion fits our mission in a way that just makes tremendous sense. This is a state-of-the-art facility that anyone would be proud to be associated with. It does make Appalachia a better place to be.